Hospitals in at least 25 states face a critical shortage of nurses, doctors, and other staff amid the surging pandemic, according to recent research from Stat News. Not all hospitals are affected equally, however, as we learned by looking at two very different facilities, one in Nebraska and one in New York. Senior medical correspondent Dr. Narula shows us how supply issues and the hard-earned lessons of past COVID spikes are making a difference now.
On the plains of Nebraska, Lexington Regional Health Center has just 25 hospital beds and 4 doctors to battle the county's COVID positivity rate of 28%. 1,500 miles away in New York, Northwell Health runs 23 hospitals with nearly 6,000 beds and 4,500 doctors. When COVID first attacked the country, New York was the epicenter, and Northwell hospitals were on the front lines.
We saw over 85,000 COVID patients since the crisis began.
CEO Michael Dowling says Northwell's size and experience during disasters like September 11th offered some advantages.
We did what was known as load balancing. We were able to use our transport network and move patients from Queens to Westchester to Eastern Long Island. If we had not been able to do that, those hospitals in Queens would have been overwhelmed.
Small hospitals like Lexington Regional have fewer resources. With the explosion of cases across the Midwest, larger hospitals that usually take their transfer patients are now turning them away.
COVID has really left us in a bit of a situation.
Hospital CEO Leslie Marsh is struggling with a staffing gap. 46 employees have tested positive for the virus. 4 nurses have resigned, and there's a shortage of traveling nurses who usually fill in.
While we have 5 ventilators right now, we don't have the staff to care for 5 ventilated patients.
What are the healthcare professionals at your hospital telling you about their concerns about the coming months?
Nurses are getting burned out and leaving. They want a job that's not so stressful.
When it comes to PPE like gloves, Lexington Regional only has about a 2-week supply. During the spring surge, Marsh used a lifeline, getting shipments from the nonprofit Angel Flight Central, which serves rural hospitals in 10 states.
And it was a lifesaver, literally a lifesaver. And I think that we'll probably have to reach out to them again here soon.
These are masks.
These are N95s.
These are N95s.
In New York,
supplies come in here, about 30 deliveries a day actually come in here from all over the globe.
Northwell's 85,000 square foot warehouse is overflowing with PPE. Northwell didn't need to rely on the federal government's dwindling stockpile. It uses an automated system to respond to each hospital's needs.
This must have been massively reassuring to your staff.
We were able to tell them, we have enough supplies, we can assure you that. That was enormous.
When you talk to some of the staff, are any of them telling you, I can't do this again?
I have not heard much of that at all. I haven't had anybody come to me or talk to me and say, I wouldn't do this again. They recognized that they saved so many lives.
We all go into healthcare primarily because we want to make a difference. And so it is an honor and an obligation and a duty and a privilege to be able to be in this field.
Northwell Health, where I am on staff, estimates it has the resources to ride out a year of projected lost revenue. The reality is states and hospitals are engaging in bidding wars against each other for PPE and for medical workers. Smaller hospitals like Lexington Regional cannot compete and often lose out. The hospital tells us it only has 12 days of cash left on hand.
Wow. So, Tara, with all these cutbacks and with the staff shortages and losses, what are doctors and nurses doing to keep themselves in this all-important fight?
Well, Tony, both CEOs really stressed that staff is their most valuable resource and asset. And there are things that leadership can do in terms of being there on the front lines, walking the halls, talking to the staff, having open lines of communication, and then little things like Lexington Regional CEO told us they brought in tacos one Saturday night to help feed the staff. Northwell, which obviously has bigger, more resources, was able to provide things like daycare, hotel rooms for staff workers so they didn't have to go home and expose their family, counseling services. But But both of the CEOs said that really what helps motivate the staff are the victories, are the survivors. At my hospital, Lenox Hill, which is affiliated with part of Northwell, they would play the song "Here Comes the Sun" every time a patient was taken off a ventilator, throughout the loudspeakers in the hospital, every time a patient was discharged. Wow. And hearing that song really helps motivate the staff and the patients.
That is a beautiful anecdote there. I love that. Thank you very much, Dr. Narula. We appreciate it.